while we open up the next section of the meeting, which is essentially kind of bringing it back to the leadership, people who have really been thinking a lot about this measure, people who have been on the stewardship council, or who will have really thought about, some of these things and have had more of these conversations with Thriving Together. And then we're going to turn all of these questions over to you all, every single one of you, to be able to ask and answer kind of some of these questions from your lens, and also dig a little bit deeper to what does it mean to kind of build out this community involvement in Okanogan County. So I am going to invite Jesus Hernandez from Family Health Centers. Alana is going to take off her CHI hat, and I'm asking Alana to be present as, somebody who's a co-director for a local organization, Rural People's Voice, and also Alana's, with her history as somebody who has led community assessment in Okanogan County within areas of childcare and youth housing. I'm also going to ask Dr. Wallace to join in on this conversation as well. And while we're asking these questions, we really invite you all to also think about how you would answer them as well. Again, although these folks might kind of have a little bit more knowledge about the well-being measure, we all want to kind of get to the same level today. So just think about that. And if you feel comfortable, put some of these answers into the chat. Okay, so our first question that we want to kind of turn out locally here is, I'd like to actually get us to think about what current measures of community health do we have that tell us how our community is doing? And I'm going to actually turn it over to Jesus first.
Thank you, Michelle. I do want to call out how fortunate we are, I think, in North Central Washington and here in Okanogan County to have the leadership not only of the North Central ACH Thriving Together for the whole region, the 4-county region, but also here in Okanogan to have such an active CHI leadership. And just reminding ourselves that the intent of the formation of these two entities was to invite cross-sector, multi-sector engagement for the benefit of everyone in terms of health and wellness. So we're very fortunate in that way, and I think it's worth celebrating that. In terms of your question, from Family Health Center's perspective, I think we tend to lean on our own internal measures of health relative to the patients we serve. And so that's kind of the first line. But we also often, for different reasons, we lean on the county health indicators that are generated every so often. They typically are 2 to 3 years behind in terms of the data when that data gets reported. We also have every 3 years a community health needs assessment that's done by nonprofit hospitals like Central Washington Hospital for the whole region, that is also of great value in assessing the needs of the health and needs of the region. And I think another one that's worth highlighting is the Healthy Youth Survey, that it's also done through the schools, which is another activity that happens on a cycle to sort of measure health and wellness. Perhaps Dr. Wallace has other things to add to that, because from a public health perspective.
Yeah, I'm purposely asking. I'm actually purposely going to turn it over to Alana,
okay.
Because this question is a little bit of a kind of a way for us to think about, why do we need another measure, right? What do we currently have, and are we using it? And is everybody using the same measure, right? So I'm going to turn it over to Alana, and specifically kind of with the communities, to keep in mind the communities that you have served, Alana. And, do those measures that Jesus described kind of resonate with you as measures that you might have used to kind of guide work or start new work, lean into
Yeah.
action.
Yeah. Dr. Smith just put in a few other ones too, the point in time count. When I was thinking about this question earlier, my first reflection was that we often, like Jesus said, use the data that is most accessible within our organizations. And there are certainly some regional and countywide measures that are out there on the CHI website that we just put into the link there. We started by asking CHI members which community health data sources they go to most, and just tried to put the hot links on there so you can see a little bit of what the trends are across Okanogan County in terms of places people often go to get data. There's another page on the website too. But my experience is that most of the time we don't go to a shared tool. Some of the fantastic tools that come from our Department of Health are usually just in the hands of public health practitioners. It's hard to remember to go to those sites. It's hard to remember to use those sites. Historically, when we've talked to CHI members too, we've heard they use the data to write grant reports, and they use the data to get funding. So it's sort of a report back and a way to get funding in, and that's no small attribute of data. And also, it's rare that community health data guides action unless it's really specific to an issue. Like the point in time count is a great example. The housing surveys that have come up in the past, Michelle mentioned 4 or 5 years ago, we led a youth homelessness survey that really went to all of the corners of populations and lifted up an important story. I don't know the story. In some ways, it guided our resources, but mostly it galvanized us. It showed that it was a crisis in front of us with very little resources. So our experience at the CHI has been talking to CHI members that we rarely have a central data tool that we use. And when we have great data that's specific to an issue and it's collected well, as in really representative of the populations whose stories don't get told very often, it can be gold. And I think there's some partners right now that are really working on that. I'm so excited for the childcare needs assessment, just as an example. I don't know if that's what you were thinking, Michelle, but yeah.
Yeah, thank you. And I think Dr. Smith put in a few as well. And I think Dr. Smith mentioned his role, introducing himself into the chat as also a board member of the Housing Authority. And we've had recent meetings about housing, right? And so unless somebody's coming around those measures as a whole, those measures, as Monty mentioned, are just data that we could drown in, or they are data points that we lean into to put us into action, right? And so, the work of the Housing Coalition, for example, yes, we are now using those data measures and making them impactful. But if they exist alone, they're not necessarily that useful for us. Dr. Wallace, I'm going to turn to you before I move on to the next question. Would you have anything to add about what measures of health currently are guiding our community, guiding us to better health?
Yeah, I'd say that what's guiding us to better health is the key question to ask about the information that exists out there. Tons of information exists out there. The information that is readily available as health indicators. The information that is published by many of our partners as health assessments or synopses of the data that we collect. Is all very important, and we can lean on that information when we're making plans as organizations or as a collective group. But the important question is what information can guide us. I love Monty's description of data that's a catalyst. And so my question in moving forward with the thriving together, the vital conditions, is how can we use this information as a catalyst, or what do we need from this survey in order for it to be a catalyst for change? And in my experience, several things have to happen. One, enough of our community members need to be surveyed, need to reach the
Mhm.
survey needs to reach the intended targets. And I would say that's everybody, but I would say it's especially folks that our traditional forms of surveys don't reach. Whether it's because they can't log on and complete an online survey, or because they need someone to interpret the language of the survey, or because they can't, access it in one way or another. I think there are a lot of folks that have been left out in our traditional ways of gaining information about the public. Um, I think, and I think Monty alluded to this too, a good survey really needs to go beyond just identifying what the problems are, but also
Mhm.
identifying what resources we have in our county, because we have an abundance of resources within our organizations that we can devote to our findings, but we need to survey those too and enumerate those too and recognize successes that have been accomplished with what we've got, because we've got to start with what we've got. And so we need to know what we've got in order to get started on some of the challenges or targets and priorities that arise through a health assessment. Um, and I think the process of the assessment, of the process of the survey itself, needs to start the ball rolling, needs to start the action. So we don't wait until a survey is wrapped up and tidy and completed and reported upon to start moving forward. But the process of doing a survey actually should get the ball rolling. And so those people that are participating should begin in early stages of action, or that catalyzing momentum should begin through the process. And so I would say we need to talk as a collective body about how to ensure that those principles are put into place through this
Mm.
survey, and how we can request assistance from Thriving Together and from each other to ensure that with the results that we gain, we can continue moving forward.
Thank you, Dr. Wallace. You asked a question in your answer, which was the next question for you all, which was, how can this measure improve community health, right? How can we make it be more than just a survey to get us where we want to go, right? To take it to that place of collective action. And one of the things that I heard you say was process. And so I'm going to, that we need to engage in collective process, right? And I think that's the idea of, bringing this to this table is kind of engaging and catalyzing. And so I'm going to turn it over to Jesus to answer a little bit more, just to kind of elaborate on this question. How can we get us to a place that we want to go with respect to improving the health of our community, and to make it be a catalyst? How do we get it to be a catalyst?
Yeah, well, just building on what Dr. Wallace said, I go back to the original intent of how and why the ACHs were formed across the state of Washington. And for us here, our ACHs Thriving Together. And it was intentional that they created the board of directors for the ACHs were from all these different sectors. Oftentimes, or maybe historically, when we think about health, we just think of the healthcare sector as kind of owning that role, or the healthcare sector being the responsible, accountable party to impact in health. And I think it's important to make a distinction between healthcare and health. Certainly, healthcare requires or implies professional licensures and credentials to practice healthcare. And that's very much an important component to the overall health of a community. But the ACHs, again, were designed with a very really multi-sector representation on those boards, recognizing that really health is something every sector, every organization, every individual, no matter what your background or circumstance or role, you can play a role, you can play a part in impacting health in the very general sense of the word. And I think that's what's, I think this survey gives us an opportunity to gain perception data, hopefully from every segment of our community, so that we can then invite everyone from every sector who's interested in contributing to the health and wellness of our county to play a role to the extent that they desire, to the extent that it aligns with their organization's missions or their own personal commitment to the well-being of our region. So I think it can be a catalyst. The survey can be a catalyst to bringing us together with shared perception data that can then guide us to whatever strategies we collectively come together with and put together to reach and target efforts, target resources, and leverage the assets and the resources that we have, optimize them. And also, it's probably important to recognize that this is hard work, and it's going to need to be a sustained effort, and being very aware and realistic about that from the get-go. I think it's important because it will take time. But I think if we have the right people at the table and maintain a big enough tent to always invite anyone who is ready and interested in participating, we can go a long way.
Thank you, Jesus. Yeah, I think you're saying it's a marathon, right? It's not a race, it's a marathon. Thank you. Alana, what would you add to this conversation in terms of how do we do it differently?
Yeah. The thing that has caught my attention from the beginning of this well-being survey and talking with Thriving Together about the vital conditions is that when we could distribute a survey, which we've done many times, and we'll talk about this later. Sometimes we do it rarely, we do it well, and sometimes we do it just based on where we have capacity. We all know sort of the patterns that can happen with surveys. I won't go into that, but I do think what's unique about this well-being survey is that it's also a community health intervention. Like when we talk about well-being, we start to change the language that we collectively can use when it comes to the vision of community health that we're stepping towards. Something that's always caught our attention within the vital conditions is it doesn't just get us to a place if, we all have civic muscle, we all have belonging, we all have our basic needs met. It doesn't get us to a place in which we can all survive, which is a story that I think has really, it's a story that we've been wearing for a long time. In Okanogan County, there's a lot of us who've been part of a safety net for many, many, many years. And this well-being measure and its larger connection to the vital conditions gives us every small opportunity to start to rearrange what we're calling for as a community when it comes to health. And that's when I think it could just be a survey, in which case we may get good data, we may not get good data, all of those things could happen. But if we are doing it in the marathon form and we're learning together and thinking together, we actually have every survey as an intervention. And I think that's exciting. That's one of the reasons the CHI itself is so strong, is because there's so many partners coming to the table with an appetite to build our capacity and strength when it comes to how we approach community health. So that's what's kind of on my mind.
Thank you, Alana. Yeah, I think you're speaking to, Alana, like one term that maybe the CHI has heard before. A CHI term, as part of our strategy or pillar strategies is mobilization, right? It's an opportunity for a form of mobilization that is long-term. And also, I think we want to kind of, Alana, you, again, I think set us up nicely. I feel like you all are planted to help me facilitate very easily. You've set up this question about we could do it well, or we could do it poorly. We could get good data, or we could get bad data, and so I'm going to ask you all to elaborate on what does that actually look like? What does it look like if we were to do it at this first stage of the marathon poorly? And what could it look like if we do it well? Like, tell us a little bit more about what that looks like. And if you don't want to talk about this measure specifically, you can talk about anything. What does it look like for us as a county to do measurement poorly? And what does it look like for us to do it well? Just in general. You don't have to talk about this particular measure if you don't feel that level of comfort around, like, well, what does it even look like to do this? We don't know yet because we haven't done it yet. So just even think about historically. What does it look like for Okanogan County? And I think I'm going to open it up to whoever wants to answer this question first.
I was going to ask if I get to go first because I didn't get to go with the last one. So
Okay.
I'm going to, I'll go. And I will say that I loved what Jesus had to offer and Alana in the last responses. And where I see commonality between those two is that, you know, Jesus talked about the recognition that to work towards better health in our county has to lie beyond our traditional healthcare partners, right, or public health partners. And we need to be able to invite more players and other sectors in. I love what Alana shared about, you know, this being an opportunity for intervention. The survey is an opportunity for intervention. We don't have to wait until the results come out to decide where to intervene. And that intervention that we're offering could be that invitation for other sectors, other people to come into play, to come into this dialogue, to recognize that when we talk about well-being, we're talking about everybody's individual, collective, organizational contribution to well-being in our county. And I think this survey could be that intervention in broadening things of concern to the health of the county to anyone and everyone that is willing to participate. So that really excites me. I'd say if we take a really quick stab at that and try and do it really quickly, it probably won't be the best that we could do. We could also wait for 2 years and we probably would still not do the best that we could do. And I'm kind of on the mindset right now that any first step that we take is not going to be perfect, but we should go ahead and take a step. Recognizing the imperfection of an initial attempt or a second or third or fourth try is always going to present itself with the opportunity to improve. And if we wait until perfection to befall us, you know, we might never do another type of survey. We really need to start a process that, like Jesus described, will be a marathon. But go ahead and take the first step, recognize that our second step is going to be better than the first, and hopefully the third, fourth, fifth will be better than the initial ones. And we'll learn how to do this really well as time goes on. We'll invite more people in, we'll get more participation, we'll better represent the people that need to be represented. And I would think that we all commit ourselves to the marathon and go ahead and get started.
Thank you, Dr. Wallace. And before I turn it back over to Jesus and Alana, I'm going to reflect some of the comments and questions that came up that I think really brought up some you know, to Dr. Wallace's point, like, you know, get in there, get dirty, get it done. And I think there are some risks, right? Like there are certain risks that I think Thriving Together is offering training. And what I heard from John Chapman, who's the executive director of Thriving Together, is he wants to ensure that those who are engaged in these community dialogues are doing so with open ears, right? Rena put into the chat, like, you know, the people we're serving are not doing okay. We know that. Like, how do I just tell you that? And instead of having to ask these not okay people to do this survey. And also we heard from Dr. Smith at the last meeting saying, like, how do I do this? How do I ask this question as a physician and also not have a way or method to connect them to something. And so these are things that I think are ethics, values questions that we're going to turn off to you in the second part. But I'm going to turn to Alana and Jesus to kind of maybe share about like, what are these, how do we control around these pitfalls, or is there a way to engage and do this well in this first stage of marathon? You know, considering, you know, those potential pitfalls.
I'm a believer in the power of our collective thinking, bringing us what you're doing with the CHI, bringing so many bright people together, and really thinking strategically and designing a coordinated, well thought out effort. I think will ensure that we avoid some of the pitfalls that Dr. Wallace mentioned, like not reaching all the people, all the segments of our community. Ensuring some degree of consistency in how we engage communities, making sure that we take this survey for what it provides us in terms of the insight, and see how it matches up with other needs assessments that have been there traditionally, that we can further augment the analysis of what we gain. Back to my original comment, I think we are very blessed to have the structure of the CHI and the structure of the ACH.
Mm-hmm. And this, what I would add to what Jesus said is that in some ways, for a measure like this to help us shift the way that we approach community health issues, we have to move at the pace of trust. And what we know, right, is that there will be some folks who have been in CHI conversations. They've been thinking about the vital conditions, and they may feel like, yeah, I can take on this well-being survey. Like, let's see if we can get 400 surveys out. And to make sure this well-being survey tells the story of our whole community, we're going to need a larger network than that. And I mean, already we see questions coming up from our CHI that give us this opportunity to model what it takes to have shared ownership, you know, to pause when our sheriff's department or juvenile detention says, I don't really know much about this, tell me more, right? And actually control the clock on how we build relationships through this thing, while, to talk to Dr. Wallace's point, we start rolling out the survey, but really take every opportunity we can get to build relationships that set us up for where we need to go in 2 years. And along the way, kind of keep our eyes on the larger goal of the CHI, which is really about eliminating health disparities and building equity in the community, which means we work twice as hard along the way to make sure that folks who this data is most important, you know, the folks who really do fill out the fullness of community health story are reached, you know, if that's migrant farm workers or, you know, people in the palliative care network who are aging at home by themselves. That's hard to do, you know, to work twice as hard or control the clock or move at the pace of trust. And at the same time, we have this amazing gift because of thriving together to experiment while we do it. Just drop in somewhere and try it out and sign up collectively, I think, to put in some stop signs along the way and check in and see how we're doing. I mean, yeah, it's an opportunity. I feel really excited about it.
Thank you.
I think I see some hands up, Michelle.
Yeah, I see Nanine. Yeah, I think we have an opportunity for a question, and then we will.
It's not really a question. I partnered with Thriving Together and helped them distribute surveys at the May Collar Walk in Okanogan. So, you know, to be honest, this is a really important discussion because, you know, as I'm trying to engage people with this survey, all the things you've talked about are definitely things that halted people from filling out the survey. That survey literally took people 1 minute to fill out, those that did fill it out in, you know, right there in person with me. And, you know, a big part of that was being put into a drawing for that $100 Visa gift card. But it's also being, you know, when we say, you know, how does it benefit me? You know, we have to be culturally appropriate. It depends on your audience. It depends on where you are. So, I mean, we have to engage. I think that while I had success, and I'll be dropping those off when I get back to North Central Region, I'm in Salish right now, but, and I felt like I had success, there was a lot of distrust about what is it for? How does it impact me? Why should I waste my time? Also, there's a digital disparity. So yes, we have the QR code, but there's a lot of individuals that don't know how to navigate that. That is, they don't even know what that little box is. That was pretty amazing to understand that. So there's all those things. Engaging also, I believe, you know, those micro communities within Okanogan County. So, you know, there's leadership within these different agencies. There's leaders in Eneas Valley. There's leaders, you know, within the Concanelli and Riverside region. There's leaders in the Malott area. So it's getting the buy-in from those individuals too, to help promote engagement for this survey, because, you know, Shelley's on here from the ESD, but the youth survey was not filled out very well in Okanogan County, from my understanding. And so what I saw at the actual event is, how do you share the importance of it and get buy-in from individuals? It's very difficult to build that trust piece in a few minutes. So you need to go to the people that already have the trust of the individuals, you know, those faith-based organizations, those cultural spaces, the Recovery Navigator program, where they're meeting people on the street and where they're at. It's that intersection of agency and community where I think it's really important that we interact there, because I having promoted it, you know, boots on the ground, we're going to need to address all of those if we want the participation levels that we're really hoping to see.
Thank you so much, Nadine. And I think there's an assumption there, right? Of we are a network that are probably connected to some of those folks that you're mentioning, who could then connect to greater levels of community. And there's also trust. There's trust that we hold with each other, and trust that we hold with our extended network. And so how do we kind of guide ourselves through some shared principles and values to be able to, you know, hold ourselves accountable to some of these things that I think lead to distrust, right? I'm gonna take one more question from Dr. Smith, because I know it's going to be a juicy one, and then I promise we are going to move on to community involvement and then turn out some questions to you. So yes, Dr. Smith.
Michelle, do you want me to ask my big question or bring up this point?
Oh, you can ask your big question if it feels right.
So I want to bring, this is going to be both a statement and a question of putting all this into practice. Yeah. First off, I think when we ask the questions, we create the responsibility to act on it to the community. So as a CHI network, if thriving together is what we're doing in those domains, then we have to do that work. We have to say, okay, we identify. I think the trick is we all know it, because everyone here is in some kind of social service. We know how people are suffering. But to Dr. Wallace's point, if we define humane housing, it gives us a space, it creates unity, and it creates a coalition. And I want to give the example of my ask on this is we created out of the CHI this coalition around humane housing and houselessness and homelessness in Okanogan County. When we get down the layers of taking that data and then going to action, or at least taking that coalition and going to action, I came across the idea of I need health-related data for impacts to our county to present to county commissioners when making decisions on legislation that affects our taxing and our use of funds to support these services. And I realized I need emergency department utilization by patients who are homeless. We need costs. Our county commissioners and people want that level of data. But what I see is that if we have humane housing as a CHI, and we have a coalition that includes everyone doing that work, then we can pool this data together. We can do this work, and it makes it very actionable. So the coalition for housing out of the CHI to address humane housing has a catalyst to affect the future of our county and how we spend funds brought in through taxes to support housing. So my ask is going to be to hospital partners. I reached out to public health, and I found it is hard to get granular data on demographics of our community and their healthcare utilization. We have some kind of larger data sets, but when our county commissioners ask us for things like this to make big change, they want the details, and we're going to have to say humane housing is built by all of this shared data. How do we get there? So that's my big ask for hospitals, public health. I've reached out a little bit, and I've hit some blocks. It's hard to get that data, but we need to be able to decide that together we're doing humane housing, and by doing that, we need to bring the things together that are asked for by our county commissioners to make it happen. So that's my ask, my big tie together. I think we're all doing this work, but I do love that these domains give us coalition building opportunities. You know, everything from food to housing. A lot of people are doing amazing work in this county today without the survey. So the survey better serve the people that are doing amazing work today. And I say that's our ethical responsibility, is that survey better make everyone doing good work feel like they're getting more support in our community, or else it's just another survey. So sorry, I'll get off the soapbox, but that's my ask to all our partners. Data on homeless sort of utilization in our county of health services, ED visits, are requested by our county commissioners to potentially enact some new legislation and laws. Thank you.
Thank you so much, Dr. Smith. Yes, it seems like there are still some areas where, in order to catalyze, right, like we need to strengthen our partnership, right? It feels like you're speaking to those issues as well. Like even within this coalition here, we need to kind of be able to lift each other up and you know, be able to share more openly. Alana, I'm going to hand it to you, and I hope you can get us through the time we have remaining. I'm so sorry.
Oh no.
I'm so
let's
sorry.
do it.
Yeah, let's do it.
All right. This is all just so good. I'm going to share my screen real quick here, and then we are going to turn over to you all. We're going to do a little that's not high tech anymore. Maybe it was high tech when we first all started doing, oops, actually I clicked the wrong one here. Stop my screen share. This is apparently the high tech part. Me just getting up the right screen. Okay. Man. Okay. It's just 1 minute here. We're gonna get there. All right. Can you all see a slideshow in front of you? Did we get there? Yes. Okay. Thanks, everybody. That took me a second. So we're going to talk a little bit about community involvement and what it takes to keep moving towards the place in which we can grapple well with some of the questions that Dr. Smith just brought up, to get us to a place where we can take a well-being measure and bring it forward to a place in which it can shift and improve community health. So in front of us here is a community involvement scale, and it may be familiar to some of you, to others it's not. On the scale of community involvement in a research, a data project, a community action, you might see informed, as in the community, and we're thinking about ourselves right now, right, as CHI members. Are we informed, consulted, involved? Are we collaborated with, or are we leading? And we're ultimately going to get to the question of what does it take for us to develop the leadership and the sense of shared ownership it might take for us to get to this bigger vision around the well-being survey. So you see informed, consulted, involved, collaborated with, leading. I'll give you some definitions, but I just wanted to give you all an example. So you all know school funding is a struggle for school districts all across the state of Washington right now, and honestly all across the country. In some communities, including Chelan County, they're closing entire schools. In other communities, they're cutting programs, they're cutting teachers, and not all communities are affected by this. Just if you were to use your instinct in this scale, if a school district decided they needed to close a school, where would you want to be on the community involvement scale? Would you want to be informed about that decision? Would you want to be consulted, involved, collaborated with, or as a community, would you want to be leading in that decision? You can put your quick responses into the chat. Leading. Thank you, Scott. Collaborated with. I can tell you in Chelan County, where a school was closed, people felt they were informed and consulted. I would say most of them felt they were being informed, and it was really one of the most challenging school dynamics Chelan County has seen in a very long time. And then the school reorganized and really tried to think about how to move up the involvement scale. Awesome. Okay, so in the terms of research, which these terms don't matter for our ability to understand this, but I did just want to bring some terms into the space in case we all want to build more language around these things. In low community involvement in a research or a data project, it might be researcher driven. If the community is consulted, maybe it's community placed research. So you ask the community, I can give you some examples of what that means. If you involve the community, you engage them, you have them participate here and there. If you collaborate with them, the term is community-based participatory research. And if the community is leading, it's community-driven research. So I put these terms up here in case at any point you would like to look them up. You can see lots of great examples of research projects that have done community-based participatory research. Community-driven research is pretty rare. I'll start from the other side of the scale. In community-driven research, the community sets the research agenda based on their interest. So, well, Michelle, listen, in my past, I was a community-based participatory researcher. And we didn't get to build the research question unless we asked the community first what they wanted the research question to be. That was deep community-driven research. When you're collaborated with, the researcher in the community might set the research agenda based on shared interest. When you're involved, the researcher might set the agenda and they might get some community input. When the research sets the research agenda, or when it's consulted, the research sets the agenda based on the topic of community interest. So somebody might come into Okanogan County and say, you have a housing problem. I see you have a housing problem. Let me research your housing problem. And you tell me a little bit of input. Or in an informed project, someone's just completely outside of the community, drops in, asks you some questions and pulls away. So I thought I would ask a few questions. Did anyone here, you can put your thumbs up. Does anyone remember the Trango survey that got our public transportation system up in Okanogan County? Was that too far away for people? Oh, maybe it was. Okay. So Trango, when they first built their public transportation model, they started with a work group, tried to figure out what are the questions that need to be answered. They tried to get to every corner. They worked so hard of Okanogan County when they first got established. They went to community listening sessions. They worked really hard to not just inform or consult the community around, the question of how to build public transportation, but instead to really turn the questions back over to the community. People here familiar with the point in time count, which is a bit of a research question, a data question? Probably it sounds familiar. I'm curious if folks want to share a little bit. When you think about the point in time count, in the last 2 years, it's shifted quite a bit. where would you put yourself in terms of a CHI member or just a community health leader on the scale of community involvement with a point in time, which is like a short period of time in which we count homeless folks in Okanogan County? Where would you put yourself on the scale of community involvement? You can drop it into the chat. Informed. That's what Dr. Wallace said. Anyone else on the point in time count? Where would you put your community involvement? Informed, consulted. The lead, said Jen. Awesome. Informed, involved, leading for youth, leading, informed and consulted. Sadly informed, consulted. Awesome. I will tell you, one of the most exciting pieces I think about the point in time count is they are working so intentionally about building that community involvement farther up the spectrum. I'm sure 10 years ago when the point in time count came, we all just got an email saying it was time to do the point in time count, and we were given our task, which would have put us all in the informed category. So I bring up the point in time count knowing that they have been very intentional across the last 2 years to try to build more champions, build more leadership, really get input from the community and how we do the process to lead a point in time count. So what are some of the outcomes based on this scale of community involvement? And we'll pivot to a new tool here in just a moment. If it's straight up informed, maybe we get better science on a topic, right? We learn a little bit more about housing, about substance use. If we're on the scale of consulted, maybe the community gets an input on the findings and they help get the research out into the community in some different ways, which probably sounds familiar to lots of us, right? We've heard a community data project, we've shared it across our network a little bit. Maybe somebody comes and presents the findings back to us, maybe take some feedback from us. If we're at the involved stage, the degree to which the community is involved, it doesn't just strengthen the outcome, it strengthens the study's design, how people get it. To Nanine's point, are we just distributing a QR code? Are there paper surveys? Are there other ways people can get access to this survey or be participants in it? In general, the degree to which the community is involved translates to how well we use the findings. If we're at the stage, of community collaborated with, we might see that we are actually all learning together through a research project, right? And it bolsters engagement, it increases our problem solving, it sets us up for the conditions to lead towards change, which is really what Thriving Together has been trying to set up within Okanogan County, and our CHI is certainly chewing on. How do we take a data project like this and set up the conditions for us to learn together? I would say a gold standard and a very real opportunity within this particular measure is that it could increase our community's capacity for research, mobilization, and change. I think what that means in practice is that when we do a project like this well, and we hold to our principles, we move at the pace of trust, we set a good research design, we're starting to build the DNA of our county to do great research, have great learning about what our community needs, share data when it gets called on by folks like Dr. Smith. To me, this really comes back to like a great community-driven data project. It is an opportunity to build our capacity. There was that quote in the beginning that Michelle said. Michelle, I'm gonna mess it up. Will you share it with me again? I don't know if you remember it. I couldn't figure it out this morning. I kept tripping on it, but it was so beautiful. Maybe you can put it into the chat. Okay. So I'm gonna stop my screen share here for a second. And we're gonna turn a question over to you all. Most of you have used Menti before. I'm gonna put it into the link for you. This may go slightly poorly. As I mentioned, this was what I thought was going to be my technical question, or my technical piece, but I messed up the last one, so maybe this will be even harder. If you click on the link in there, This is a quick Menti survey. So I'm going to pull up the survey results here. So the first question for us is, what's your level of involvement in the well-being measure so far? If you're having challenges with the Menti, please do just put into the chat. Michelle could help you navigate that. I'm at my tech capacity. This is all I can do. So Michelle can pop in and help you. What's your level of involvement so far? I'd love for everybody who's on the call, as long as you're still paying attention, to drop in here and share your reflections. Awesome. Okay, check the chat, see if there's anyone else in there. Consulted. Ah, there's Michelle's quote. Thank you. The means are the ends in the making. Oh, awesome. This seems about right, right? You see lots of folks informed. I would imagine if we are a very small sample, but if we took a bigger sample of the community health network, we'd probably see about this range too. So I'm going to move us to the next question, which apparently you all are able to move to the next question. Why did you select that level of involvement? Some folks said, I'm learning about it right now. I'm still learning about it and how to do more. Someone said, I'm leading the shared measurement task force. Like, I was in on the ground floor of this thing. I'm a newcomer to the CHI. I'm helping with survey collection. I haven't been involved. I was introduced as a done deal to implement, but I'm in line with the current work. I think a lot of us were in that stage too. And leaders contact me directly. That's awesome. Okay. So the next question we're going to ask you all is, what would bring you from informed to involved? So there's quite a few of us who are at this informed stage. If you're trying to move from informed to evolved or informed to collaborated with, this doesn't, it may mean that you are somebody who's like, I'm already collaborating, I'm already leading with this project. I really want it to challenge and encourage us to think about a project that we come into where we're at the informed stage. In general, what does it take to move us from informed to involved? Give me a specific task to do. Time and repetition. Some explanation of how it would improve what I already do. Opportunity to give feedback and change how it's done the next time. Present the work in regard to current activity. Get buy-in. How does this impact the community in a sustained and community person way? It's equitable, inclusive, sustainable. Let's have strong partnerships. All right, we're going to move to the next question here. How do we get our community health network to a higher level of involvement? What works? So this isn't just this. I encourage you to think about that question, which was about you, and really think about, what do you think it takes to get a community health network to a higher level of involvement in a project like this? You could repeat it. You could say, give them specific tasks. Give more people specific tasks. Make it really clear. Concrete action steps. The ACH's commitment to supporting next steps. I'll share with you all, one of the reasons we're pausing on these questions is that we are thinking about what do we need from our CHI to build community involvement. This is you all giving direction, guidance, and helping us think together about how we move from wherever folks are and continually up the scale. I'm curious from our leadership council folks who are on the call, as you look at the list of things on here, is there one thing that really resonates with you? I'll read the last two: being present, sensitive to culture, active listening, include youth voice and choice. So Mike, Karen, Melody, Jesus, John can participate in the chat.
I really like that first one, making it clear of what this will lead to, what impact we can expect. I think that can really engage folks.
Yeah. I'm curious whoever put that in there. If you want to add a little detail in the chat, or you can put it in there, or if you can make another note. I wonder what that means to make it clear. How do we do that? More community conversations, making a brochure somewhere down the road. Health activation and empowerment of a community in a way they understand and is culturally informed and relevant. Awesome. Oh my goodness, are we at time? We are at time. Okay. I think what I'm going to do here, Michelle, is stop my screen share because I do want to honor how much time. For some reason, I was looking too far past 1:45. The time that these folks have. What I'm going to ask you all to do, just to sort of close this up here, we're going to stay in that Menti presentation. We're going to stay in that Menti measure. I'll share my screen one more time here. And I would love to get us to 2 questions from where we are now. So we're going to skip. Oh, please do add anything you want to add. You want to put in here to integrate a measurement of well-being. What needs to happen? What do you think successful well-being survey looks like in Okanogan County? If you all can jump ahead with me to close, to get us closer to close, we're going to have you help us with this very last question, just to get a bit of a read around how our CHI is doing. So from the scales of strongly disagree to strongly agree, are folks here with me on this page? I can only see the front end, not the back end.
Yes, we can see.
Okay. So the first one is, I'm ready to share the well-being measure with my community. And you're strongly disagree to strongly agree. You can tell me if it's working. If you've put in data that it's not working. Oh, nice. There we go. Okay. Coming in a flood. And please do answer each of these questions. The second one is, I participate, but I'm hesitant to put lots of resources in. And the third one would be, I would not participate. It doesn't feel useful right now. And you're all welcome to drop into the chat if you're having a hard time. I closed the Menti survey. Thank you, Casey. And now that I'm back in, I can't stick it forward. Gotcha. Well, now we know. Thank you, Casey, for sharing that. All right. We'll share this out with you all after this by email too, so people can add a few more questions in here. This is going to be our closing question. Does it feel useful to have a well-being assessment team? Steward this measure forward, something that's local in Okanogan County. Other ideas? I'm not sure we're quite here, but if people have instinctual responses to it, like, yeah, that seems right, please do let us know. Even welcome to say I do not know. Please do pop into the chat too if you can't get back into the Menti. Yes, 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 yes. Awesome. Okay. Great. Thanks for that note from the Shared Measurement Task Force. On your mark, get set, go. I love it. Okay. I will tell you, if you would like to skip to the Menti, the next question is, who will you nominate to be on that measurement team? We'll keep talking with Thriving Together and see how these things can keep nesting and building together. And then we'll follow up by email with all of you with some of these survey questions. again, get some names for you to put in here. Please do put in the chat if you just want to put somebody on alert that they are being nominated onto the task force. You're so welcome to. Thank you all so much for joining us today. I'm kind of hurrying us off here because I know you all have so many important things to do. Thank you, Monty, Jesus, Dr. Wallace, Michelle, Sarah, Veronica. Really appreciate it. Nanine and Brendan, thank you so much for your great questions too. And I think Dr. Smith may have stepped off, but we'll make sure that his request gets out to you all because it's a big one. Thanks everyone so much for joining us.
The thing,
oh yes,
if you want paper surveys, I will deliver. I just drove to Pateros this morning to just drop off paper surveys. So I am willing to put in the miles. If you want paper surveys, swag, QR codes, posters, you want me to come talk to someone, reach out.
Thank you, Sarah. That's very important. I really appreciate that. I was like, I know there's paper surveys out there somewhere. No doubt.
There are.
Yes. All right. Thank you, everybody. Enjoy your Thursday. We really, really value this time together.
Thank you all.